Hi, welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa, as well as Hair and Scalp Wellness. I'm so excited to be here today at Raritan Bay Medical Center, right here on the Woodbridge campus, and we're going to be touring the beautiful surgical suites upstairs where they have a beautiful robot that is doing magnificent surgery here. We're going to speak to some amazing professionals who are working with the robotic surgery. We'll be speaking to the president of the hospital, Michael Diagnis, as well as Dr. Sabido, who is the director of robotic surgery. So we're so excited. What a great wellness opportunity to discuss all the things that are available right here on this campus. It is awesome to be in the room with the actual robot. I'm here with Irene, who's the nurse coordinator here at Raritan Bay Hackensack Meridian Hospital, and it is such an honor to be here to be able to see the robotic surgery unit that we use here. So Irene's going to explain to us why the robot, why do we need this for clients to help them with health and wellness?
Thank you. I think that for the area here, we've been able to serve them better having the robot. The pain tolerance for our patients, they now have the ability, after having robotic surgery, to go home with minimal medication. So oftentimes the doctors will give them maybe a Tylenol, an intravenous Tylenol here prior to surgery, and an injection of a medication that may last upwards of 24 hours or more. And this way they don't need to take any pain medication.
Oh, that's wonderful. So it's actually healthier for them, less recuperation. And what type of doctors choose to use this robot as their surgical choice?
Currently we have general surgeons, we have urology, we have OBGYN, and we have colorectal.
Wonderful. And so this robot's equipped to do all of those different types of surgical procedures.
It is. It's amazing what it can do.
And a lot of different doctors are utilizing it?
Right now we have done well over 100 cases. We started 5 days a week, August of this year.
That's great. Do the doctors need a specific training in order to use the equipment?
They do. Several of the physicians that we have on staff have come from other facilities. We have two, a general surgeon and the OBGYN physician that went for training. And so we've worked with them and it's been successful.
That's great. So Irene, I know you're going to explain to us what each of these components are and how we're able to utilize them, but it sounds like a great wellness benefit because it's a win for the doctor, making the surgical procedure even more precise and accurate, and also for the client who has less recuperation time.
So we actually have a special bed that works in conjunction with our vision cart and our robot that has the ability to move along with the robot. We pair it. So this is our vision cart. We have our robot here, of course, and then also the surgeon console. So the surgeons will start off laparoscopic and then move on to the robot once it's docked, and they'll sit there at the surgeon console and have the ability to manipulate the robot.
It's amazing. I can't wait to see every integral part, and I know you actually have a procedure here in a few minutes, so we don't want to hold up any more of your time, and I can't thank you enough for giving us this tour and letting everyone experience what amazing technology we have our hands on right here in Woodbridge, New Jersey.
Thank you.
Thank you. We're here with Michael Diagnis, who is the president of Raritan Bay Medical Center here on the Woodbridge campus, Hackensack Meridian. And I'm so excited to ask you, so why the robot?
Well, the robot was a natural extension of us becoming part of Hackensack Meridian Health Network. Prior to being in the network, we never could have afforded the robot, nor could we have attracted the physicians, the surgeons that would be using the robot. Once we had discussions with Dr. Sabido and other surgeons who said they would gladly come if we had the robot. we realized that it was technology that was necessary for Raritan Bay. Woodbridge with the 5 new ORs was the natural location. So as a result, we went ahead and ordered the robot. Actually took possession the beginning of the year, but it took some time to get the program started. But it's just another example of all the benefits of being part of this big network within Hackensack Meridian Health.
Well, it's a huge benefit, I think, to the clients. From what I understand, we're going to get a little bit more involved as to what it actually does and how it helps. But have you had trouble booking the usage of the robot?
You're going to probably have to ask the doctor that question. My understanding is no. We hope that we have trouble going forward, because that means we're going to need a second robot. But so far, a number of our physicians that were already on staff were trained to use the robot, and we've attracted physicians who heretofore were not on staff who wanted to use the robot. So as a result, I believe we're booking by days or half days where surgeons can get a block of time to use the robot for their cases. And you're right, the technology, and Dr. Sabido will go into it, it's so much better for the patient in terms of the time in the OR as well as the recovery is vastly different, and he'll go into detail on that.
Well, it's wonderful, and you're centrally located, like we've talked about before, you know, right in between 18 and 9, close enough to the Raritan Bay location, also in Perth Amboy, that you can send multiple cases here, and then close enough to Monmouth County as well. So, well,
and especially with the growth that's anticipated in and around the Woodbridge area, this hospital over the next few years is really going to grow considerably. Maybe at a later program we could talk about an ED emergency room expansion that we anticipate here. I'd love to share that with your viewers.
That'll be wonderful. I mean, you do so much for the community here. You've always done so much for the community, and I just feel that this addition of technology is probably something that's really going to take us, you know, well into the next millennium.
Without a doubt. This is a home run for us.
We're so excited about it, Mike, and thank you for coming and joining us today.
Thank you.
I'm here with Dr. Fred Sabido, who is the Director of Robotic Surgery here at Raritan Bay Medical Center, but I'm going to ask him to explain a little bit more about his credentials. Doctor?
I'm a native Staten Islander. I went to NYU Medical School. I did one of those crazy 6-year advanced programs out of high school instead of just traditional, so I did not take an MCAT. I've been interested in robotics since being in medical school. Right now I'm Director of the Center for Robotic Surgery here at Hackensack, and I've recently been recruited to be Director of Robotic Surgery for the entire Mount Sinai Health Network in New York City.
Wow.
Yeah, I started in 2014 training on a pig in a pig lab and on cadavers, and sort of pioneering the technology for general surgery and a lot of procedures.
With the robot?
With the robot. So the robot's been around since 2009, and now here at Hackensack we have the latest generation robot, which is called the XI, and that just came out 2 years ago.
Amazing. So it's much different than the original robot that you were using.
Absolutely. This one has 4 arms, the incisions are smaller, the advantages are less parietal trauma, less trauma to the skin and the organs inside, 3D visualization, the ability to operate under low pressure. When you do traditional surgery, laparoscopy, you blow the abdomen up with gas. Take out a gallbladder, do a hernia, do a colon resection, take out a prostate, etc. With the robot, you lower the pressure and let it be maintained at almost physiologic, so there's no pain, there's no stretching of the muscles. Okay, and we use 8mm incisions instead of 12, so patients go home earlier and they don't require any narcotics whatsoever.
Well, that sounds like a win for the patient and a win for the doctor and a win for everybody. So that is truly amazing.
Absolutely.
What types of doctors do you have currently using the robot here?
Most programs in the United States are started out with GYN and urology. Robotic prostatectomy, if you've heard of the name David Samadi in New York, he started that. He's also a graduate of the same program I am. He's a great surgeon. But robotic prostatectomy is now standard of care. It moved on to robotic hysterectomy in GYN, and now we're in the phase of general surgery and thoracic. So now it's a multi-specialty type of operation in robotics. All of the procedures are less time on the OR table. all with smaller incisions, less trauma, and zero pain, and they're going home sooner. So your length of stay of 7 to 10 days is not heard of anymore.
Right. Well, that's truly, I mean, in this type of medical environment that we're in, I know that people like to get home as soon as possible, and this allows that.
Absolutely. When I do robotic hernia surgery, we're telling the patient they can go back to work the next day.
Wow.
We're only giving Motrin post-operatively. The incisions are in the umbilicus, and then there's a 8mm incision laterally on the abdomen that you can't even see. So we tackle all the hernias that way. If they have reflux or they're on medications, which can eventually cause cancer, we encourage them to get the robotic procedure, have their diaphragm fixed so they don't reflux anymore. If they have diverticulitis, we do the colon resection that way. If they have cancer, the same way.
That's amazing. So basically, you see a lot of GYN, a lot of general surgery. Any other surgeries of like orthopedic that would be using this yet?
Orthopedists have tried. There's a robot called the Mako, which has been out for several years. However, it has not really made a difference in terms of length of stay. Has to do more with the fact that you're in a joint space, and there's not much of a pain difference whether or not you're using a robotic instrument or a laparoscopic or arthroscopic instrument. In the abdomen, however, the ability to operate under these low pressures with zero blood loss, without burning any tissue, with no tissue trauma, that's what makes the difference in post-op recovery.
Right, and you had already said that to me, but as far as using your human hand and feeling that control during a surgical procedure, have any doctors kind of felt like they still need to do that, or does the robot usually generally work better for most cases?
It's very hard to develop the tactile sense when you're operating, but once you get it, you sort of get it. I'm a program director. I train fellows every year on how to operate on the robot. And just to be clear, the robot doesn't operate itself. It's a slave robot that we control at a console. So the patient is asleep about 10 to 15 feet away from me, and I'm sitting on a console and doing the surgery through a three-dimensional camera.
Wow.
You have to be light with your hands, but you will get the tactile sense on how to handle the tissue. So it's a training process. And right now, surgeons all over the world are using this on a daily basis to improve their outcomes.
And they're transitioning into it okay.
Yes.
Like even someone who's been doing surgery for how many years, not using robotics, you're able to train them to do it.
Absolutely. They take a weekend course, then they go and they do case observations where they watch surgeons, and then they'll have proctors like myself come in and take them through each procedure 3 or 4 times to make sure that they get it down and make sure that there's no injury to tissues and that they're comfortable with with the technology.
And post-operatively, they probably see the benefits for the patient also, so it just makes it a win-win for everybody.
Absolutely. They actually call me up and they thank me for showing them how to do a hernia, showing them how to do a colon resection. They say, my patient went home in 2 days. I don't believe it. Used to be 7 days in the hospital, and with the the insurance companies being upset with you.
Yeah, that's wonderful. We were speaking to Mike about that, so a lot of doctors are coming here to the area to want to use the robotic.
Access is a problem in New York, New Jersey, everywhere. The machine itself is a $2.4 million acquisition.
Wow.
The service contract is $100,000, and you need to have facile surgeons to start your program. So Mike recruited me and brought me from Staten Island, where I already built a program there, so that I could teach everybody, and then brought the most experienced surgeons here. That's how you get going, and then once that happens, you have a panel for every specialty. In other words, an experienced thoracic, experienced GYN, experienced general surgeon. You bring on the other surgeons one by one and train them, and the program just grows.
Does that make this kind of like a teaching hospital for robotics?
Absolutely.
That's wonderful.
Absolutely.
Oh, that's so exciting.
It is.
We're really excited to have it here in this community, so close to both Raritan Bay, medical centers. So it's wonderful.
When you look at the Hackensack programs that have started in robotics since the beginning, up in northern New Jersey, the average Hackensack program did 130 robotic cases in its first year. Our projection, based on our first 5 months, is 212 cases in our first year.
Wow.
And that has to do with our roster of surgeons and the enthusiasm in the community to have these procedures done now and get back to work earlier.
That's wonderful. So we'll be seeing a lot more doctors come in the next few years to utilize this machine.
Absolutely.
We're very excited to have you here.
Thank you very much.
Thank you, Dr. Sabido, and thank you for your time.
Okay.
And thank you for all the good things you're doing for health and wellness.
My pleasure.
So thank you for joining us today on Wellness Woodbridge. Raritan Bay Hospital, thank you for letting us tour this amazing facility. We're so excited to see what this new technology can bring to the area. So until next time, thanks for watching Wellness Woodbridge.